Treasury has set the record straight on the G2G deal, and of course we'll be telling you what is the latest about that as and when we get the facts. Now, the Court of Appeal has overturned the orders preventing the implementation of the Social Health Insurance Fund 2023 following an appeal by Health CS Susan Nakhumicha. Our health reporter Elizabeth Atieno with the latest highlights on the implementation of the Social Health Insurance Fund that will require Kenyans to have their salaries, or rather contribute 2.7% of their income to the health fund. Have a look.
The government secured a major victory as the Court of Appeal on Friday lifted an injunction preventing the enforcement of the Social Health Insurance Act of 2023, the Primary Healthcare Act of 2023 from page 21 to 22, and the Digital Health Act of 2023. The decision followed an appeal by Health Cabinet Secretary Susan Nakhumicha against an earlier High Court ruling. According to Nakhumicha, the blockage created a service gap, leaving 17 million Kenyans dependent on NHIF without adequate healthcare. Court of Appeal judges Patrick Kiage, Pauline Nyamwea and Ngenye Masharia identified 3 provisions of the Social Health Insurance Act to remain suspended pending appeal hearing. These include Section 26, subsection 5, which makes registration and contribution a precondition for dealing with or accessing public services from the national and county governments or their entities. Section 27, subsection 4, which provides that a person shall only access healthcare services where their contributions to the Social Health Insurance Fund are up to date and active. And Section 47, subsection 3, which obligates every Kenyan to be uniquely identified for purposes of provision of health services. The High Court stopped the implementation of the Social Health Insurance Fund on the 27th of November 2023, following a petition filed by Joseph Enoch Aura. The executive, led by President William Ruto, criticized the judiciary, accusing them of corruption and undermining development agendas. This now means Kenyans will have to dig deep into their pockets and contribute 2.75% of their income to the Social Health Fund, which incorporates 3 separate funds, including the Primary Healthcare Fund, Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. The new deductions will be capped at 5,000 Kenya shillings, while those in informal settlements will pay 300 Kenya shillings. The Court of Appeal also set strict timelines for the submission of written arguments. The petitioner and supporting parties are required to file within 7 days from today. The registrar of the court will subsequently allocate a hearing date for civil appeal on a priority basis, with a deadline not later than the 31st of March 2024. Elizabeth Atieno, TV 47.